Dr. LeBlanc, tell me, is there such a thing where you would say, people running around out there and have a reason to go to a dentist and should do something they might not be aware of because, things are more or less going pretty good, but there's some sleeping danger there or some sleeping, whatever you might call it. Is there something like that out there where you advise people and say, go and check it out?
Yeah, there's three big ones, really. Two people already know about. Decay. Why do you go see a dentist? Get x-rays to make sure there's no decay. Decay is very prevalent. I read somewhere the other day, I didn't even know this, and I've been at this 23 years. It was a trivia question. What's the biggest disease in the world? And decay was the answer. So the other thing, of course, is the gums.
And you mentioned, sorry to interrupt you, you mentioned in another video that you had this girl coming in, lady, and she had a very badly decayed tooth, which apparently 6 months before would have been a small filling, good forever to go, more or less. Kind of like no major
6 months
damage.
to a year later, we would have done a filling and she'd be good to go. Yeah. Mm-hmm. And it's tragic, especially with the young people. She was in her 20s. When people in their teens, 20s, 30s come in and they have problems like that, it bothers me. It was just lack of prevention, and that's really sad. The other thing, of course, is the gum disease. We pull more teeth out from gum disease than any other reason. Mm-hmm. Most people know why they're seeing the hygienist every 3 to 6 months. It's so that they can control their gum disease. But the third one, the one that I'd like to mention a little bit, is the silver mercury fillings. Even when I graduated from USC 23 years ago, that's what we were doing. That's what we were being tested on. The problem with the mercury, it really isn't that the mercury is poisoning us or causing Alzheimer's. I'll leave that to someone else to figure out. But what the mercury does to the teeth, and there's about 50%, so the makeup of the silver mercury filling is about 50%. I ask people to think of a thermometer, the old-fashioned thermometer, the bulb kind with a mercury in it. You know that mercury expands and contracts tremendously with temperature changes. So when I look at the thousands of teeth that I've seen with mercury fillings, they crack your teeth. As you're eating hot and cold foods and liquids, your silver fillings are expanding and contracting, breaking your teeth. So people come in with the silver fillings, I show them on our intraoral camera, and they go, my gosh, can you save that tooth? Because it looks so bad. There's cracks everywhere. And then I'll show them a tooth that doesn't have a silver filling, and there's no cracks, none whatsoever. So, and then, of course, they break down around the edges, and you get decay around the silver fillings as well. So silver fillings, silver mercury fillings, are the one thing I don't think people understand just how much damage they do to their teeth.
That's a very interesting point you're bringing up about, the expanding of the silver. Because, it's true, and I don't think there's lots of talk about that. There's the poisoning, yes or no, and that might not be. But then again, lots of dentists will say that as long as it is contained well, there's really not that much danger of the poisoning. But the point is, you say it cracks it. It's like a bottle of beer. Put it in, freeze it, and bang, there it is. It may be on the way down, but either way, the expansion and the traction does it.
Silver fillings are a dentist's best friend because of the damage they do to the teeth. But,
so it's not the chocolate, huh?
It's a little of that and a little of this, but I'm just saying I don't think people understand how much. They can look at it money-wise, they can look at it time-wise, they can look at it agony-wise. But, get those silver mercury fillings replaced. They will save you time, they will save you money, and that will save you agony.
What about the argument of some dentists who say that if the silver filling is in there, basically fine and good with not, whatever you guys consider being kept and well put in, you might do more damage taking it out than you do leaving it in. What about that argument?
If a silver filling is very small, with no hint of any decay, I would say I probably leave it in. If it's of any size at all, And I can't remember the last time I took a silver filling that was more than a few years old out that didn't have some decay under it. So after 23 years of doing this and seeing tens of thousands of them, and what I find under, and we have a lot of technology here at Portola Dental, so I'm able to show the people what I find under it. I'll take an intraoral picture and I'll show them, and they get this look on their face, and they go, that's in my mouth, and that was in my mouth. So it's real easy for me now to say, just do it. Whereas 15 years ago, 20 years ago, I was more hesitant. I'd go, let's just watch it. Let's just watch it for a while, you hear. If you go to a dermatologist and he says, hey, you got a cancer, let's just watch it.
Right? Let it watch crack.
If you go to an oncologist and he says you got a cancer on your arm, and then he says, why don't we watch it for a while? It's not that bad yet. Boy, I don't know. That doesn't sound too smart to me.
Right. Right. Well, obviously, I mean, the stuff can go under there because, as you said, it expands. So it expands, it detracts again, and that gives it some space, because the tooth doesn't move back again. You know what I mean? Or I mean, it may not crack the tooth. It may only you go skiing in the wind and it may go down, and then it leaves the tooth alone, and then stuff can go in it and all that. All right. Well. Okay.
Well, I still think people should go ski in helmets, so I don't think that affects it. But
I definitely should. I definitely think they should go skiing.
Definitely.
Do you ski?
I've been snowboarding lately, Helmut.
Oh my God, you must be still very young. All right, bye-bye.
At heart.